My name is Dr.Lemm. I have a clinic in Berlin and Mahakala Retreat Center in Montenegro. I'm specialized for detoxing the body, borreliosis, female health and nutritional therapy. This is my new series recording my patient in hope that can help you as well. If it does, please help us to be able to do it more, and subscribe and put a thumb. What is the reason that you're coming to me?
Well, I had a serious borreliosis infection 4 years back, and I went to the hospital and my heart almost stopped, and I've been on the road to recovery ever since then. In the last years, I've been feeling really good, but now suddenly I started to have very low blood sugar and blood pressure and low pulse as well. I'm feeling very heavy. I'm starting to get headaches and also certain similar sensations I had when I had the Lyme disease. You know, of brain fog, fogginess, heaviness, sluggishness. And also I had some problems with my period. It's very weak when it comes. I had a big break of years of not having it. Now it recently returned, but sometimes it's late, sometimes it's very weak. So I just feel like there is something that is wrong and needs to be checked.
Borreliosis came in my life because my son 15 years ago had very severe borreliosis, and the mainstream medicine gave him severe depression diagnosis, and he couldn't stand up from bed. And this was a very heavy time for me. And when we discovered that he has borreliosis, and when we started to treated, he became slowly, that means after a month better, and every month better and better, and after the 6 months he was not only lying in bed like he was almost for a year. At that time, that was 15 years ago, I treated only with herbal substances, with 5 or let's say in general 7, and depends individually what a person wants and tolerated. We start different things, and minimum 5, 1 are really leading almost always to feeling better. I'm not treating at that time and not now with antibiotics. I'm only giving doxycycline with acute borreliosis. If you know, this is really happening 1 week ago, because the most of patients who are coming to me, and I've saw hundreds of patients, are having after antibiotics even more problems. For the short term, that could be good, but then on the long term, because the immune system through the microbiome, which is really low after antibiotics, is really no real cure. When I started to have really results recently, since few years back, and I'm going to talk with you about, because I would recommend it to you, because there is only one medication who is also killing the dorma or the sleeping borreliosis. Borreliosis is infection very similar, either if this is not even though it's not a virus, but it's staying in a body like a herpes. So you know, the most of people have herpes, and then it's staying here, and if our immune system is not fine because of stress or whatever, it's coming and breaking out, and we have a herpes on our skin. This is very similar with borreliosis. So until a few years ago, there was no medication to treat borreliosis really completely. because of this sleeper or dormer. And you feel, the most of patients, like my son, they feel like almost healthy, but then if it's stress, they don't feel good, and this is always like coming and going. Maybe this is also one of the way that the immune system tolerate this dormer borreliosis, and we are fine and we can live long term and becoming old and don't have serious other health issues. But my approach is my personal, to me as well, because I discovered that I had borreliosis as well, is that I don't want, when I'm older, to have dementia. I want to pay attention to my brain as well. And this is influencing our cognition and our memory. That's why it's really worth to get rid of completely of that. So I tell you, or I'm going to mention one great medication, which I'm so grateful this is existing. And story is also interesting, how I realized this medication is so powerful. It was starting a few years ago of one seminar. Actually, Dr. Klinghardt was mentioning there is a new medication, Disulfiram, which is only one really treating properly the borreliosis. And afterwards, I bought this medication. That was 4 years ago. I didn't know so much why I just bought it, and it was in my cabinet at home. And after about, let's say, 2 years, I was thinking, oh, this is already here, and I don't do that, or I don't try it, and I'm not let's say, able to give proper treatment or recommendation to the patient if I don't try it. All the things I'm recommending to my patient, I tried all. So that means I bought it for me only to try, to be able to give it to the patient. But like very often I actually was thinking, oh, I do something for the patient, but I discovered that I have borreliosis as well. And I didn't want to start with this medication without blood test. And when I had a blood test, I was so surprised. Wow, I have borreliosis. I cannot believe it. And then I've done a laboratory test with another one, a laboratory, and it came the same. And it looks like this is the acute infection. So the long story short, I've done this treatment with this medication a few years ago, and since then I have not 100 but maybe 50-60 patients I treated with this Disulfiram. What is it and what I would recommend you? This medication is like very often not discovered for borreliosis. It's discovered to treat addicted alcoholics, because if they deciding not to drink, they are very often having relapses and start again. If they are on Disulfiram, they are becoming very sensitive to alcohol, and they get so strong pain that the body is learning, oh, alcohol means pain, and they really are free of the alcohol afterwards. So that can really help alcoholic, and in other countries is also used. In Germany is now not used for these purposes because it was very high dose. I don't know how they managed to start with 400 milligrams, because in this treatment for the borreliosis we start very little and gradually coming up. That's why it's tolerating become very easy, or easier, not maybe very easy, but it's easier. So and then I don't know 100% how that was discovered, but I think in America at university, John Hopkins, they will see this is working against borreliosis. Definitely, I saw a study from Johns Hopkins where representing the results, what happens, and they compared all antibiotics, and only on Disulfiram are the patient on the long term after a few years free of the borreliosis. Then I saw a few videos on the YouTube for the patient who have this treatment, and then I was thinking, wow, really great, I'm starting with that. So this medication is really only one I know of that is at a long term, not only according to the Johns Hopkins study, also according to my experience, because I'm since 2 years free of borreliosis and I feel much better, and also all my patients as well. So I don't have even one patient who completed the treatment that is not free of borreliosis. I have a few patients who didn't go completely with this treatment. So why? Because side effect could be sometimes tiring, and we need really to pay attention what we are going to eat. So you are not allowed to take anything with alcohol, even toothpaste or facial cream, nothing. Even fermented food can contain a little bit alcohol. That's why it's important really not to eat fermented food. And what is also difficult for a lot of people, that's why some of them are not starting or breaking the therapy, because it's very long. And on the long term, this 8-9 months, not to eat outside. Because if you eat outside, you really cannot eat anything with vinegar or any sauces, because you don't know what is actually inside. So you're going to eat very healthy. So you are really forced to eat very healthy and to cook at home, or if you go out, to tell them, please just fry without any additives, only salt and olive oil, vegetables or meat or fish. And this is possible. Even the very simple restaurants who makes just steak, they can make you vegetable, with broccoli and potato only boiled with salt. And you eat then some beans if you are vegan, or some meat if you don't. So this is possible, but for some patients I realized more difficult than I was imagining. And what is also very difficult, no alcohol. I have here maybe few hundred patients I talk now with you, and maybe 40% didn't even think about first time to use it, because I can't imagine not to drink for 9 months, not a drop. And this is also the reason why some patients don't go this way. For example, my son is a good example. He was actually cured for borreliosis, but he is not with really his best energy state. And this is very typical with all patients I treated since 20 years. They are all really better and they feel like, oh, I'm good, but they are not in full power. That's why it's maybe good for you to consider this therapy, to be able to have more energy, to be free of the allergies, especially the food allergies. I lost the most of my food allergies after the Disulfiram treatment. I didn't expect that, but it happens. The therapy was, for me, I would say, even though I'm very, very, very sensitive, okay. I need to pay attention, and few times I had diarrhea when I got higher with the medication, because we are starting little and I have my protocol. This protocol is gradually coming up, and you have then 4 milligrams per body weight as a end dose, and this end dose should be taking minimum 8 weeks, optimum 10 weeks. So when you are heavy, so you have a longer treatment. You get my protocol, and you can take slowlier but not faster. So faster is really not working. You will have more side effects, because always when you go up, the patient, especially after a few months, feel like diarrhea, like fogginess, and then the body is adapting and is getting better. 2-3 times I needed to go down to the lower dose and then start again. And my side effects are very representative, and they are very common, like some sensitivity, sensation in my hand, and then I go down, and then it's went. And only if it's went, this is the most serious side effect, is this neuropathy. If it's there, you really need to get rid of that. You stop the medication, and then you see, are you going to start again with that, with slowly a dose.
What is the side effect you said?
Neuropathy, that means some sensitivity, discomfort, like very gentle maybe pain in the nerves. This is the most serious side effect. Not everyone has it. I had it one time during this 9 months. Then I stopped the medication and start again, and never came again. I had few times diarrhea, and then I didn't increase and waited, because diarrhea for 1-2 days, I don't think this is too bad. And I keep going, but not increasing, but with the same dose, and then it was releasing.